So what did we do? We had 4 laws that changed the way that medical financing occurs. We submitted them into Parliament. They were registered. And when they came up to a vote to even be just included on the agenda, Parliament couldn't drum up enough votes to even talk about it. And the saddest thing is it isn't that they voted against it because they have a problem with the laws. They just didn't vote. They were either not present or they didn't vote. After that happened, there was a huge wave of discontent among civil society that Parliament doesn't even care enough to vote about these laws. It forced the formation of a working group within Parliament to go over the laws and to take a look at them and see if there's anything that we need to change in them to make them more friendly for voting into Parliament. After that working group finished working, there were 22 members of Parliament, and then there were 3 representatives from the Ministry of Health. It culminated in a National Reforms Council meeting with the President and all of the representatives. The Cabinet of Ministers has supported the reforms from the very beginning. The Prime Minister has been behind these reforms from the very beginning. It was voted on and as a concept in the Cabinet of Ministers last year. The Cabinet of Ministers has always, and the Prime Minister Groysman have always been behind this. We just last week had the National Reforms Council where the President has now taken on healthcare as well as a priority. And at the National Reforms Council, he requested that Parliament vote these laws in by the end of this parliamentary session. That's something that we have been saying from the Ministry, and the Cabinet of Ministers has been asking the Parliament to do. But now I think with the presidential administration and the President on board, it'll be pretty difficult for Parliament not to follow through on these plans.